Podcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thanks for joining us today for our webinar on navigating household employment during the COVID-19 pandemic. My name is Trevor Sparks with GTM Payroll Services. I'd like to welcome clients of GTM Payroll who are with us today, as well as our placement agency partners, and I know we have other families joining us as well. So welcome to everyone. I know this is an unsettled time for many families who are likely dealing with a lot of stress in their professional and personal lives, working from home, caring for children. It's been challenging, to say the least. And on top of everything else, you have a household employee to worry about as well. And that's what we're here for today. We'll try to provide some insights and guidance. We're going to answer some questions we've been hearing and answering from our clients at GTM. And we're hoping to bring some clarity to you about household employment, give you some confidence, and help you make smart decisions. A couple of things before we get started. If you have any questions, you can submit them in the question or chat box of the webinar console. We'll try to answer as many questions as we can. If you don't hear from us, we'll try to follow up with you later and get answers to your questions. Also, you'll receive an email after the webinar with a link to download these slides, other resources we'll talk about today, and a link to view a recording of this webinar. Unfortunately, Kristen Stengel was going to deliver this presentation, but is unable to today, so I'll be filling in. Oh, hang on one second, there we go. Just a little bit about GTM. We provide comprehensive payroll, tax, insurance, compliance, and employee benefit services to families who have a nanny, housekeeper, senior caregiver, or any other type of employee to work in their home. We've been doing this for about 30 years and serve thousands of families and their employees across the country. As mentioned during our time together today, we'll answer key questions and provide the information you need to make the right decisions for you and your employee while complying with wage and labor laws. So let's get right to it. Our first question today, are my household employee and I considered essential? Essential workers are defined by your state and sometimes by a local authority. Some examples include doctors, nurses, police officers, firemen, first responders, utility workers, grocery and pharmacy workers, and those who work in essential services like auto repair, shipping, and hotels. As far as household employees, home healthcare workers or aides for the elderly may also be considered essential. Again, check any executive order in your state to see if your employee can still report to work if they are a home health care worker or a senior caregiver. As for nannies, their continued employment will vary by state. A couple of examples: in New York State, child care services are considered essential. In California, they are essential when they are caring for the children of essential workers. And there are local orders as well, especially in California and San Francisco, for example. Home-based child care and elder care workers are considered essential. Our next question, can my employee file for unemployment even though I'm not letting my employee go? And the answer here is yes. If your employee has reduced hours or is not working any hours at all, they could file a claim for any week when they perform no work and are not paid. And they can file a claim for partial benefits for any week where they work for you, but at a reduced number of hours. Now, a big heads up here. You need to have been paying your employee legally in order for them to receive unemployment benefits. If you've been paying them off the books and they file for unemployment, they may be denied benefits, and you'll likely get a call from your state's labor agency. Now, for GTM clients, remitting your state and federal unemployment taxes is part of your service with us, so you are all set here. If you need to get caught up on taxes, we can help with that, and we'll provide some information at the end of the presentation if you need that back tax work. Also, you may want to hold off terminating your employee right now, and that's something we'll also get into in a moment. The U.S. Department of Labor is letting states to allow for unemployment benefits if an employee is quarantined with the expectation of returning to work after the quarantine is over, and if an employee leaves work because of a risk of exposure or infection, or to care for a family member affected by COVID-19. Now, each state administers their own separate unemployment insurance program. So if you're deciding that unemployment is the best way to go for your situation, check with your state's unemployment program to determine your employee's eligibility. Our next question, what is the Families First Coronavirus Response Act, or the FFCRA? The FFCRA was the first big federal legislation that addressed the COVID-19 pandemic. It was signed into law last week and takes effect on April 1st. This law provides paid sick and family leave beginning April 1st for certain circumstances related to COVID-19. It applies to employers with fewer than 500 employees, so that obviously includes household employers. The Family and Medical Leave Act, or FMLA, which typically doesn't apply to small employers, is now in effect for employers with fewer than 50 workers. The law also provides employee job protection if an employee takes paid leave. Continuing with the FFCRA, your employees can take leave if they themselves are quarantined or isolated due to COVID-19 concerns, or they're experiencing symptoms of the disease. Also, if they are caring for someone who is quarantined or advised to self-quarantine. And if they need to care for a child who is home because their school or daycare is closed due to COVID-19. Our next question, does my employee qualify for benefits under the FFCRA? FFCRA does require families who have an employee working in their home to provide 80 hours of paid sick leave to their employees and up to 12 weeks of family leave, 2 weeks unpaid, 10 weeks paid, for employees affected by COVID-19 who have been employed with you for at least a month. There is no tenure requirement for paid sick leave. Your employee must be working for you on or after April 1st in order to receive benefits, and can take benefits through the end of 2020. And you'll get fully reimbursed for paid sick and family leave through payroll tax credits. We'll get to that in a moment as well. That's why you may not want to terminate their employment right now. If you can continue to pay them until April 1st, then they can be eligible for benefits and nothing essentially comes out of pocket for you. So what are the benefits under the Families First Coronavirus Response Act? So we have a couple of different scenarios here. First, if your employee is sick, they can take 2 weeks of paid sick leave at their regular rate of pay. This is for when an employee is unable to work because they have been quarantined or experiencing COVID-19 symptoms and seeking a medical diagnosis. If they need to care for someone who is quarantined or may be sick, they can take 2 weeks of paid leave at 2/3 their regular rate of pay, but the maximum amounts are lower. They can use this leave when they are unable to work because they need to care for someone who is subject to quarantine. All right, continuing with employee benefits. If your employee has children and they're home because their school or daycare is closed, they can take leave at 2/3 their regular rate of pay for 2 weeks. And the last bullet here is the extension of FMLA to small employers. As we mentioned, household employers are typically exempt from FMLA, but the FFCRA extends FMLA's provisions to household employers and their workers. So your employee could take up to 10 weeks of paid leave and 2 weeks of unpaid leave to care for a family member affected by the coronavirus. The condition here is that they need to have been working for you for at least 30 calendar days to take advantage of the extended paid leave. And we'll say this again, you need to be paying your employee legally in order to take advantage of the tax credits and for your employee to use paid sick and family leave. There are a couple of PDFs in the handout section of the webinar console. The FFCRA poster details all of the benefits available to your employee through FFCRA, and the HR compliance bulletin has more detailed questions and answers if you're interested in learning more. Again, if they're paid off the books, you'll need to talk with them on how to proceed. They can't get paid leave, they can't get unemployment. Our next question will focus now on you as the employer. How do I get the tax credits for paid leave under FFCRA? So good news here is that this is a dollar for dollar tax credit. Whatever you pay your employee for paid sick or family leave, you can reduce from your employer taxes. This is for qualifying leave provided between April 1st and December 31st, 2020. So again, good idea to try to keep your employee on board and paying them through April 1st. What you'll do is retain the funds that you would otherwise pay to the IRS in payroll taxes. Typically, household employers remit taxes every quarter to the IRS. What you can do starting April 1st is hold back any money paid to your employees for qualified leave from your quarterly payroll taxes. The taxes you withhold from your employee include federal income taxes and FICA taxes, Social Security and Medicare. You're also remitting your share of FICA taxes. Whatever that tax amount is that should go to the IRS, deduct the amount you paid your employee for sick and family leave. If your total payroll tax amount is not enough to cover the cost of paid leave, you can seek an expedited advance from the IRS. Details on how to get that advance have not been released yet, but as soon as we learn more, we'll let everyone know. For GTM clients, you'll be able to indicate the hours for employee paid sick or family leave in your client portal, and we'll be able to deduct that amount from your quarterly taxes. Again, this all starts April 1st. Our next question, can I deduct the benefits provided by FFCRA from my employee's paid sick balance? You may already provide paid sick leave for your employee in your work agreement. The benefits provided by the FFCRA are in addition to whatever paid leave your employee already has. So they could take 2 weeks under FFCRA, and if they still need time, they can use the sick time provided under your work agreement. FFCRA doesn't replace what they already have, it just adds to it. Our next question for employers, do I continue paying taxes during this time? If you are paying your employees, you will continue to withhold payroll taxes like income taxes and FICA taxes and pay FICA and unemployment taxes. If your employee is on paid sick or family leave, you can retain whatever you're paying your employee for qualified FFCRA leave and not remit that amount to the IRS. Our next question, do states with paid sick leave cover for COVID-19 even if my employee isn't sick, but I am? So let's get into state mandated paid sick leave. Many states like New York, Massachusetts, New Jersey, Washington State, and others have paid sick leave for employees, including household workers. If you and your employee have been paying into these accounts, every state is different. Sometimes the employer pays into it, sometimes both the employer and employee pay into it. You should check with your state for specific guidance. If you're a GTM client, we've been taking care of this for you, so your employee is covered by any state paid sick leave law. But in general, paid leave should cover your employee if they contract COVID-19. In addition, some states cover employee time away from work even if they are not sick. They or a family member may be ordered to quarantine, and if the employee can't work, that missed time may be covered. For example, in New York State, employees can take paid family leave if they or their family members have been ordered to quarantine or self-isolate or have been advised to by a physician. If you as the employer are quarantined and your employee can't work because they can't be at your home, they are likely not covered by any state paid leave provisions. You can go to our website in the resource section for a state-by-state breakdown of laws that apply to household employers. We also provide links to state labor agencies, which will have details on what is or isn't allowed under paid leave laws. Also, in the handout section of the webinar console, there is a PDF with state-by-state links to COVID-19 resources for employers. Our next question, do I need to document when or why my employee doesn't come to work? It is a best practice to begin documenting your employee's non-working time. Keep a record in chronological order of the employee's usual days worked, the days they did not work, and why. Keep all email and text exchanges related to their absences, and write down the details of any conversations you had with your employee regarding the reason for them not coming into work each day. Note whether you or they were responding to an order from the state, city, or a medical professional regarding work continuation. Also note whether they were paid for the time not worked, and if the pay is part of an agreed-to benefit in their work agreement or part of paid leave from the government. Our next question, is it okay to let my employee go because of the COVID-19 pandemic? Household workers are employed at will, which means they can be terminated at any time for any reason, as long as that reason is not discriminatory. If you are considering termination, you'll need to review your work agreement and follow any terms you agreed to with your employee as far as ending their employment. If you guarantee hours for your employee and you tell them not to come to work, you may still need to pay them since they're available to work and you're telling them to stay home. That's something you'll want to discuss with your employee if you get into that type of situation. If you don't want to pay guaranteed hours, you may need to end their employment. Terminating employment because you no longer want your employee or anyone else for that matter working in your home due to a fear of spreading the coronavirus is compliant with termination law. However, you would be discriminating against your employee if you terminated them because they have been diagnosed with COVID-19. Because an illness is considered a disability, so you can't fire them just because they got sick. Your employee's job may also be protected because they are diagnosed with COVID-19, are showing symptoms of the virus, or are under an order to quarantine or self-isolate. They could also be entitled to a benefit payment through your state's paid sick leave, so you may want to explore your employee's eligibility for paid sick leave in your state. If you look in the handout section of the webinar console, there is a PDF titled Employee Compensation and Benefits During Closures and Furloughs. This goes into greater detail on issues you may encounter when terminating or suspending employment due to COVID-19. I encourage you to download that PDF. So that's all the legal points in terminating an employee. Of course, there's also that human element. Like we said, this is a challenging time for everyone, including your employee. They may be concerned about job security and their finances. Remember, you hired this person to care for your children or an elderly loved one. You have trust in them. We often hear about how a nanny or senior caregiver becomes part of the family. There is a personal relationship that develops between employer and employee that you may not find in the traditional workforce. So Keep all of that in mind when you're deciding how to proceed. Communication is important to remove any fear or confusion about losing their job. If it's financially feasible for you, you may want to continue paying your employee even if they aren't working for you. If you can't, then consider the paid leave or unemployment options. And for GTM clients, if you decide to let your employee go, you'll want to make your payroll account inactive. That way, when this situation is over and you're ready to bring back your employee or hire someone else, we can get you back up and running quickly. It's easy to do this online, or give us a call and we'll take care of that for you if you want to make your payroll account inactive, which we highly recommend. We've covered a lot of information. So if you need a customized answer specific to you or someone to research how to be compliant in your situation, we offer a household HR concierge service that can help. This is an additional service to our payroll and tax service. Typically, we consult with household employers on compliance matters to make sure they're following federal and state labor laws in hiring, employing, and terminating their workers. With the outbreak of COVID-19, we're fielding a lot more questions about continuing to employ or terminating a household worker during the pandemic. Maybe you need someone to review your work agreement for termination language or consult with you on the best way to handle your household employee. So we can help with that. Our household employment advisor, Kristen Stengel, is the one to contact if you need assistance beyond what we have provided here. If you're behind on your nanny taxes or have been paying your nanny off the books, we can help with that too. We'll get you caught up on your back taxes and then set up payroll for your employee and tax withholdings for you, so you don't have to worry about that anymore. Getting compliant will also mean your employee will be eligible for any paid sick or family leave from the federal government or your state, and for you to take advantage of the new tax credits. You can call us at 800-929-9213 for a complimentary, no obligation consultation with a household employment expert or to get started. Some additional resources for you. We created a COVID-19 resource page on our website. Bookmark that page. We'll keep it up to date with any new developments. But this page has a lot of the information you need during this time, including all the resources that are in the handout section of this webinar. Our blog has some posts on the FFCRA and unemployment that are worth checking out. And if you want to look into state regulations like paid leave or get links to your state's labor agency, you can check out our state-by-state resource page. The U.S. Department of Labor has put out a Q&A and information on employee paid leave rights. The Q&A is similar to the PDF in the handout section of the webinar console, but this is also a very good resource. So once again, thank you for attending today. I hope you found this webinar useful as you figure out how to proceed with your household employee. Look for an email later today with a link to download the slides and other resources related to the presentation. We'll also post a recording of this webinar and let you know where to find that. So we have a few minutes left, so we do have time for a couple of questions, and we'll do a couple here. If you have been submitting questions, we've been trying to answer as many as we can during the presentation. If we didn't get to your question, we'll do our best to follow up with you as soon as possible. But we'll get to a couple here. Just looking at the questions. When figuring out pay for our nanny for paid leave, do we include overtime hours? That's a good question. You know, as we know, many nannies work more than 40 hours a week. So for the FMLA expansion, which lets your nanny take 10 weeks of paid time off to care for their child who is home from school or daycare that has been closed, you need to pay them for hours they normally would have been scheduled to work, even if it's more than 40 hours a week. But for the paid sick leave, which is the 2 weeks of leave if they're sick, you only need to pay up to 80 hours over the 2 weeks. So if they work 45 hours a week, that means 90 hours over a 2-week period, you would only need to pay them for 80. There are also daily and a total cap on what they can be paid for sick and family leave. So you only need to go up to those caps. Oh, and one other thing, now I'm thinking about this overtime question. You're paying the regular rate of pay for all hours of sick leave or family leave. You don't need to pay their overtime rate for any of these hours. So whatever the regular rate of pay is what you're applying here to these hours, not overtime. I think we have time for one more question. This one's good. We're non-essential workers and working from home, but there is a shelter-in-place order. Can my nanny still work for us? So these are becoming more common, these shelter-in-place orders. So let's say you're healthy, your nanny's healthy, you would like them to continue working, they want to continue working, but there's a shelter-in-place order. So some of this will depend on your state's executive order. I think in California, shelter-in-place orders still allow for home child care. I just saw Ohio stay-at-home order also allows for nannies to work. Denver's order says nannies can work if their employers are deemed essential, but otherwise they can't. So really need to check those city and state orders. Keep in mind that a shelter-in-place is intended to cut down on people moving around. If your nanny relies on public transportation or makes any stops along the way, you'll potentially be exposed and bring that into your home. So are you confident that they are practicing social distancing when they're away from your home? So I guess some things to consider with the shelter in place. Number one, what does your state's executive order say? Number two, does an allowance for in-home child care apply to essential workers, if you're an essential worker, or to all workers? And then lastly, if you're not essential, does it really make sense to have your nanny come to work during a shelter-in-place order? So it looks like we have come to the end of our time together today. Once again, just want to thank you for attending. I wish you, your families, and your employees good health, and I hope you have a great rest of the day. Thank you.